Well, time now for your questions, to put them and get them answered by our panel in our daily Q&A. Joining us today are the Director of the Institute for Government, Bronwen Maddox, Professor of Public Health, Linda Bald, and, as ever, the microbiologist from Reading University, Simon Clark. Nice to see you all this morning. Bronwen, this is the first question for you from Tyler. With Boris Johnson in hospital and Dominic Raab deputising with him, does Raab himself have the authority to extend the lockdown?
It's really not clear, and that you're not going to find a very satisfactory answer, and you'd be absolutely right. I think this is raising a lot of questions about whether the UK needs to be much, much clearer, way beyond this current episode. But in my view, does he have the authority? Yes, because that's, if you like, a mid-level decision, the big ones having been taken about the lockdown and about the bailout. But if the lockdown were to go on and on, it's something, it puts more and more pressure on Raab. After all, though, it is a cabinet decision. We are governed by the cabinet, and the cabinet's going to have to agree on that. So for the moment, yes, but you can absolutely see bigger questions coming down the line where people would be more uncomfortable without a much clearer sense of what exactly the powers that Raab has are.
I mean, it's a bit worrying if you're saying that, because I suppose someone could say, well, if Dominic Raab doesn't have the power to extend it, I'm going to ignore it.
No, the cabinet, he has the power to tell the cabinet what he thinks should be doing and to adjudicate what the cabinet's different views are. And I think the cabinet will be pulling together on this. We are governed by the cabinet. And so if the cabinet, led by Dominic Raab, says the lockdown goes on, I think people should take that as the full authority of the government to say so. But it would be, I think, helpful to people to understand more clearly what powers there are that might go way beyond this current episode. Now,
the first question for Linda comes from Losaf. Is now the right time to quit smoking, or will that weaken my immune system?
No, now is absolutely the right time. So we know that smokers are at greater risk of many of the underlying conditions, including respiratory conditions, which make the outcomes for COVID much worse. So this is the key time. And in fact, the National Centre for Smoking Cessation and Training, which was set up to support stop smoking services in England, is offering a Quit for COVID service by phone and text. So I wouldn't worry about your immune system being compromised. The benefits of stopping smoking start almost immediately. Now, I know it's going to be difficult for people when they're stuck at home, and we're all worried about alcohol, drug use, tobacco use, diet, etc. At the moment. It's hard for everybody. But I think this might be the right time, and it certainly will be good for respiratory health in particular, and the other conditions we know are linked to tobacco use.
So if you stop smoking now, it could improve your chances if you get COVID-19?
I think we've not seen much data on specific cases, but what we know generally about stopping smoking and having any kind of infection, and particularly, obviously, for people, let's hope not many, but for people who have to go into hospital, their recovery particularly will be better if they're not smoking. And that includes quitting smoking even a few days before having to use healthcare services.
Thank you for that. Simon, Ned has got the first question for you today. He wants to know how much research is being done with existing drugs. Could they help reduce its impact and mortality rate? And I suppose there will be a lot of interest in, I think it's called hydrochloroquine, which Donald Trump seems to be a big fan of.
Yeah, that's a malarial drug. That's been used in combination with with a HIV drug, protease inhibitor. They've also used HIV drugs in combination. They're in trials. So what people are looking at there is the ways that that HIV's life cycle can be inhibited. Can they use those drugs to inhibit the similar lifestyle, not identical, but similar lifestyle of this coronavirus? The malaria drug is thought to affect the pH of cells and therefore inhibit the replication of the virus. So there is plenty of work being done. Using drugs that are already in existence means that they're perhaps a bit quicker to get through the trial process.
So President Trump could be onto something?
Well, he might be onto something, but I'll point out to you that somebody went out and scoffed a load of that drug, that malarial drug, in an attempt to prevent themselves getting COVID-19 and died because, of course, in large doses it's toxic, like many drugs. So, in fact, perhaps listen to the doctors rather than the president.
Okay, thank you for that. Bronwen, of course, everyone is wishing the very best to the Prime Minister, but Michael wants to know if the worst was to happen to the Prime Minister, what would happen then in terms of the government?
The Cabinet would pick a successor. It might be Dominic Raab, but might well not be. If there was more than one candidate, it would go to the Conservative Party rules in which MPs and sometimes the wider membership have a say. We've all become a bit more familiar with those rules in the past few years than we thought we would be. And so the Cabinet, at the very least, would put up an acting Prime Minister while that process went through. But if it all coalesced around a single figure, then that person would become Prime Minister and would go to the Queen.
Thank you for that. Linda, Ashley wants to know if you have any advice for the mental well-being of a child that is used to sharing time between two family homes, presumably two parents who are separated, but now appears to be confined to one. What would your advice be?
Well, actually, the government has been quite clear that it's still okay for children who have shared custody between two parents to go between those two households. So that actually is the advice. But clearly, lots of people are deciding not to do that, and that's entirely understandable. And for social distancing is probably a good idea. So it's hard. I mean, all parents are concerned about their children, whatever age they are, but clearly maintaining contact with the other parents is going to be crucial. So using all the technology that we have now, digitally, FaceTime, even just speaking on the phone, frequent contact, and even doing things I've heard from my own kids and others, playing games online with relatives, sharing information for quite an extended period. So I'm very concerned about the mental health and well-being of lots of our young people at the moment, particularly those who suddenly had to leave school, in some cases without any exams and not knowing what's happening next. So clearly seeing the other parent and indeed any other family members, even if we can't see them face to face, we need to find all the ways we can to maintain that contact.
You work in public health. What can be done in the present circumstances to monitor, to know what's going on with mental health of children or indeed the wider community?
Well, there's a number of pieces of research that are now underway, actually looking at exactly that from King's College London. In fact, they've just launched a huge survey today asking the public to take part, which I think is fantastic. Other pieces of work as well. The mental health charities are really stepping up. There's lots of numbers people can ring. So we are monitoring this. Researchers are monitoring this. My own personal view is that the mental and physical health consequences of lockdown, not just in the UK, but globally, will be substantial and long-lasting. And for people who already have a diagnosed mental health condition, we are seeing worrying bits of evidence coming out about symptoms worsening. So those people need to keep in contact with their key worker and health professional, even if that's just digitally or over the phone. So we shouldn't underestimate this. And the longer these restrictions go on, the more concerned I will be. But we all need to look out for each other, particularly those that are most vulnerable, and keep checking on them.
Now, Simon Clark, the big question for you from Thomas: when should we see the peak of the virus in the UK?
So I expect, given the models that have been proposed, to see the peak begin this weekend at some point, give or take a couple of days. So for some time I've had Easter Sunday, which is this coming Sunday, in my mind, give or take a day or two. But it's important to remember that that peak will last for some days, possibly a couple of weeks. We've seen that elsewhere. And then, and only then, when we've got past that, will we start to see the numbers fall. The numbers are highly unlikely to start falling immediately after we reach the peak. And
when would you expect to start coming down off that peak? Because of course, if we flatten it, it's more of a plateau than a peak. But when will we be trending downwards, do you think, on present evidence?
My guess, and it is just a guess, is around about a fortnight from now.
Okay, yeah, thank you for that. Bronwen, John wants to know, he says the government keeps repeating they're following the science. We've just been hearing some of that. What's happening about an official exit plan?
They're trying to find one. I think that's what you can say in common with every other government in the world, and none at the moment really has one. Even though we've heard from China that they're, released the lockdown on Wuhan, we'll see what happens, but obviously they'd be prepared to clamp down again. There isn't going to be a real exit plan back to normal life, in my view, until there is a vaccine or other medicine that can combat this properly. So it's really a question in the time before then, perhaps quite a long time, of how governments can begin to release these social constraints and edge people back into some parts of normal life without it all flaring up so that it doesn't overburden the NHS, and just trying to contain the degree of infection. And so they're going to begin to look at what we know so far, and obviously we know even quite a bit more than a few weeks ago, about which measures appear to have had most effect. And for example, there's some debate about whether schools are or aren't a big help in containing infection at the moment. And they begin to try with models very carefully to build up a picture of what happens if you release this or what happens if you release that. But they really don't want to encourage people to lift it all at once and start bursting out of this. And as we said, we're not even at the peak. But there is pressure. You heard quite a bit of pressure, I think, before the Prime Minister got quite so ill about where is the exit strategy. Keir Starmer, the new Labour leader, came straight out of the traps saying that, a bit unfairly in my view, in that no government has really got one yet. But we're going to have to start looking at both areas of greatest economic cost and least medical risk in trying to edge our way out of this.
I mean, Simon, you're nodding as Bronwen was speaking there. I mean, is there even the embryo from a scientific perspective of what an exit plan might look like?
No, not what an exit plan will look like. There'll need to be a judgment, and I'll just say I think Bronwen's analysis was spot on. The government will have to sit down with the advisors, their mathematical modelers, and decide how best to let their foot off the brake, so to speak. We're seeing cases flare up again in China. I'll remind people that Japan, who thought they'd got it under control, have just declared the state of emergency again. So we're seeing cases start to climb. Singapore, the same. So this is with us for some time, and I think we will lift controls and then have to reintroduce them at some point, but in a sort of bit-by-bit way.
Linda?
So what I would really hope, again, just coming back to your question about mental health, is the longer this goes on, the more anxious people are going to be. And what they need is clear information. Now, there are reports that have been produced from Belgium and from Germany looking at different options for releasing the lockdown, even if, as Simon says, we have to impose those restrictions again in future. So I think the public needs to know when the government is thinking about this. And a bit like the slow release we saw of some of the reports around what the strategy has been to date, and the data underpinning that, the modelling underpinning that was slow to come out. We need the government to be very clear about what the potential options would be. So, for example, are schools a priority? Primary schools, for example, would you have half the class going back in and not allow parents or grandparents onto the school grounds? Would there be particular businesses that might be permitted to open? Might people have to, in an office environment, go in for shifts? Be told you're only going in the afternoon and only a small number of you. There's all kinds of options, and I know we're some way away from that, but as soon as they start being actively discussed, I think we need some public discourse about them and not all of it behind closed doors.
Thank you very much indeed. More in a moment here on Sky News Today.